I told you there is a way to help your baby sleep independently without leaving them to cry? Sounds too good to be true, right? Well, gentle sleep methods do exist, but here's what nobody tells you. They require a completely different mindset. They require a longer timeline and a level of commitment that goes beyond any cry-based method. I'm Jen, Nurse Practitioner, IBCLC, and today we're diving into the gentle alternatives, the chair method, the pick-up, put-down method, fading techniques. I'll give you the honest truth about what works and what doesn't, and why most gentle methods fail. Before we start, I want to address something important. There's often judgment around sleep methods, like gentle is better or cried out methods are harmful. That's not what the research shows, and it's not helpful for parents. Some families thrive with gentle methods. Others find them more stressful than brief periods of crying. Neither approach makes you a better or worse parent. The biggest myth about gentle methods, that they work for everyone if you just try hard enough. The truth is, gentle methods have a much higher failure rate than cry-based methods. Not because they're bad, but because they require very specific conditions to succeed. In my last episode, we talked about easy and the routine-based approaches. Today, we're looking at actual sleep training methods that don't involve leaving your baby to cry. Let's define what we mean by gentle sleep training. The key characteristics would be baby is never left alone to cry. The parent provides immediate comfort when baby protests. Changes happen gradually over weeks and not days. And you focus on baby's comfort throughout the whole process. There's no time limit on how long this process takes. The trade-offs are there's a much longer timeline. You've got 2 to 6 weeks instead of the 3 to 7 days of some of the cried out methods. It requires much more parental energy and consistency. There's a higher chance of inconsistent progress, and it can be emotionally draining for parents in different ways. Important distinction is gentle doesn't mean easy. Many parents find gentle methods more exhausting than the brief cry-based approaches because they require weeks of intensive involvement. It's harder to get research backing behind these gentle methods because it takes 4 to 6 weeks, and it depends heavily on consistent parent responses, which is difficult to actually research rigorously. Let's talk about the chair method. The chair method, also called camping out or gradual retreat, was popularized by Dr. Kim West, and here's how that one works. The basic process: week 1, you sit in a chair next to your baby's crib during all sleep times. Then in week 2, you move your chair halfway across the room. Week 3, you move your chair to the doorway. And week 4, your chair is outside the room, then you eliminate it. What do you do in the chair? You provide verbal comfort and shushing. You provide minimal physical comforts, maybe brief back rubs. You stay until your baby falls asleep, and then you return to the chair for all the night wakings. Now, in 2010, a study by Mindel followed 56 families using the chair method. There was 67% success rates after 4 weeks. The average time to fall asleep reduced from 45 minutes to 15 minutes. There was less parental stress during the process compared to extinction, but 23% of families ended up switching to a different method. Evidence check, 2.5 out of 5 stars. Limited studies, moderate success rate. The problem I see is that babies who get more stimulated by parents' presence can't sleep watching their parents sit next to them. There's an inconsistent application where parents want to give in by picking up their baby. It takes too long to move the chair. Some families stay in that step 1 for months. And night waking increases initially as babies protest the change. So who could the chair method work for? It could work for those babies who find a parent's presence calming, not stimulating. Parents who can sit still for 30 to 60 minutes without engaging with their baby. Families with consistent schedules and caregivers, and babies under 8 months old. Babies older than that can find it more confusing than not. Now let's talk about the pick-up, put-down method. It was made famous by Tracy Hogg and is exactly what it sounds like. The process is you put the baby down awake in a crib. If baby cries, you pick them up immediately. You comfort until they're calm, not asleep, but then you put them down awake. And you repeat as many times as needed. In theory, the baby learns that the crib is safe because the parent always responds. The gradual habituation to falling asleep in the crib is the goal. There's no abandonment feelings because the comfort is immediate. In reality, research shows that this is not great. Most evidence is anecdotal from sleep consultants and parent reports. Evidence check, 1.5 out of 5 stars. Very limited research. What we do know from clinical observation is that it can work for babies under 5 months. It often backfires with older babies who see it as a game, and the success highly is dependent on parent consistency. And it can take 2 to 4 hours on that first few nights. The real challenges include the physical exhaustion for parents lifting 15 plus pounds 50 times a night. It can become overstimulating for your baby. Mixed messages can increase baby's confusion and high abandonment rate when parents get exhausted. It might work for those very young babies under 4 months old, babies with easy temperaments, and parents with physical stamina and patience that can go in and out pretty regularly. And it's okay when used for very short periods only. Now let's talk about the fading techniques. The fading techniques involve gradually reducing your involvement in your baby's sleep process. There are several variations. There's the presence fading, where you gradually spend less time in the room. The touch fading, where you slowly reduce physical contact. The sound fading, where you decrease verbal comfort over time. And then the routine fading. You simplify bedtime routine elements by shortening the duration of those routines. The example of touch fading. In week 1, you hold your baby until they're drowsy. You put them down awake. And then in week 2, you pat and rub your baby in the crib until they're calmed down. Then week 3, you take away the constant pats and you only give brief back rubs when they cry. Week 4 is no touching, just presence. And week 5 is you leave while your baby is awake and you let them settle themselves. Research on the fading methods are a little better. In 2018, a study was done comparing that to standard extinction. Fading took an average of 17 days versus 4 days for extinction. 71% success rate for fading versus 84% for extinction. Low parental stress during the process and higher parental satisfaction with the method that they chose. Evidence check, 3 out of 5 stars. Some research, positive but slower results. Why can this work? It respects baby's attachment needs and allows for gradual adaptation. It maintains that parent-child connection throughout the whole time, and there's a less dramatic change for baby to process. It does require incredible consistency, and it's easy to get stuck at one stage. Progress can often be non-linear. You'll have good days and bad days, and it can take a total of 4 to 8 weeks in total. Let's get down to the basics of the timeline. The timeline between the cried out methods versus gentle methods is the biggest difference. They work on completely different timelines. The typical timeline for the cried out extinction method is 3 to 7 days. The Ferber method, 5 to 10 days. The chair method, 3 to 4 weeks. The pick up put down method, 2 to 6 weeks. And the fading technique can take 4 to 8 weeks. While gentle does take longer, it sometimes can help with the parent's stress level as far as they feel like they're meeting their baby's needs. Baby doesn't experience the pressure to figure it out quickly. Changes are so gradual that baby may not even notice them. There's no clear end point like with baby's cried out methods. What progress looks like with gentle method is that week 1 can often look like no progress or even a little regression as they're confused. Weeks 2 to 3, small improvements and then setbacks at the same time. Weeks 4 to 6, more consistent progress, and then full success after that. Manage your expectations. Many parents give up on gentle methods because they expect a linear progress of just a straight line of improvement. But with gentle approaches, you might have a great night followed by 2 rough nights. This is normal, it's not failure. The red flags to watch for in order to decide if you need to switch would be no improvement after 4 to 6 weeks. Baby sleep is getting progressively worse. Parent exhaustion is affecting the family functioning. and the increased anxiety in baby or parents. After working with hundreds of families, I can usually predict which ones will succeed with gentle methods. They work best for the young babies under 6 months old because they're more adaptable to gradual changes. The sensitive temperaments, they get overwhelmed by abrupt changes. The secure attachment, those babies find parent presence genuinely calming. The consistent caregivers, making sure that everyone is on the same page and there can be a really good consistency with the same person implementing the plan. Parent personalities are huge. Parents have to be able to tolerate the slow progress, and there has to be a stable environment. No major life changes during this process. You can always consider switching. There are times when you can try the gentle methods for 6 weeks and have no success. Babies can become more agitated as they see their parent just sitting there not intervening. Then you can switch to the fervor method to try it out, and you could be better in 4 days. There's no shame in switching methods if gentle isn't working. Sometimes the kindest thing is helping baby to learn the skill more quickly. Consider switching when your baby gets more agitated with your parent presence. There's no progress after 4 weeks. Parent exhaustion is severe. Multiple caregivers can't maintain consistency, and there's a time pressure. You're returning to work, or travel is coming up, or any of the above. The top mistakes are: 1, having inconsistency between nights. Doing the chair method one night, then holding the baby the next. Commit to a method for a minimum of 2 weeks before you evaluate. Mistake number 2, moving too slowly through the stages. Staying at each chair position for weeks instead of days, or staying with the holding on until their drowsy stage for way too long. Follow the recommended timelines, even if your baby protests. Mistake 3, giving mixed messages. Sometimes picking up during chair method, sometimes not. Focus on what you decide to do from the first step of the process. Make sure you're consistent. Mistake number 4, starting too late developmentally. Trying gentle methods with mobile 10-month-olds, probably not going to happen. They're just going to want to play with you if they see you sitting there. Consider your baby's cognitive development once you're making that choice. If you decide that gentle methods are right for your family, here's how to maximize your success. Make sure that your baby is healthy and well rested. Optimize your sleep environment first. Make sure that the room is cool, dark, and you've got a noise machine going, and be consistent with your routines. Get all the caregivers trained and on board. Clear your schedule for 4 to 6 weeks minimum to avoid those disruptions. Have a realistic timeline expectation. Like we talked about, these can take a while. During your implementation phase, you want to track your progress weekly, not daily. You're going to have backup plans for bad nights. Maintain your daytime routines as consistent as possible. Get support for your partner and family, and document what works and what doesn't. Reduce crying over weeks, not days, is the goal. Shorter time to fall asleep gradually, and fewer night wakings over time. We want your baby to seem less anxious at bedtime, and we want to make sure you feel like you are doing the best thing for your baby. My clinical recommendation is if you choose gentle methods, you have to commit for at least a month. Half-hearted, gentle methods always fail and can make sleep worse. But if it's working, even slowly, it can be incredibly rewarding for both. Now let's recap. We know that gentle method doesn't mean easy. It requires a different kind of commitment. Timeline is 4 to 6 weeks, not days. Success rates are lower than cry-based methods, but satisfaction can be higher. Age and temperament matter. It works better for younger and more sensitive babies. Consistency is everything. Half measures will usually fail. And switching your methods up is okay. Sometimes the kindest option is for everyone to just get through the cried out phase if you need to. If you're considering gentle methods, honestly assess, do you have the 6 to 8 weeks to commit? Can you be consistent every single night? Are you choosing this because it fits your family or because you think you should? Next episode, we're going to talk about the most controversial topics, which is bed sharing and co-sleeping. I'll give you the safety guidelines, cultural context, and help you make informed decisions for your family. No judgment, just evidence. If this helped you understand gentle methods better, Please like and subscribe, and I'll see you on the next one.